Hand washing, aseptic technique. This procedure will be done before and after seeing the patient or touching the patient. Prior to washing your hands, you will push up the sleeves, remove any jewelry and/or your watch. Adjust the water temperature to warm. You will wet your hands and wrists under the running water, keeping the hands lower than the wrists and forearms. Avoid splashing water onto your clothing, and avoid touching the inside of the sink. Make sure to apply 3 to 5 milliliters of liquid soap. Then proceed to rub the soap all over the surfaces of your hands. Rub your hands vigorously together for at least 15 seconds. Lather all the surfaces of your hands and fingers. Clean under the fingernails if nails are dirty, and rinse thoroughly, keeping your hands lower than the forearms. Then you will proceed to dry your hands thoroughly, moving from the fingers up to the forearms and blotting with a paper towel. Make sure that when turning off the faucet, you do so with a paper towel. Donning personal protective equipment. Prior to donning personal protective equipment, proceed to meticulous aseptic technique. Assess the need for personal protective equipment, such as when a patient is in contact isolation. Make sure to don the gown first. Your uniform may become exposed to potentially infectious secretions. When donning the gown, pick up the gown by the shoulders and allow it to fall open without touching any contaminated surfaces. Slip your arms into the sleeves. Then proceed to fasten the ties at the neck, then the ties at the waist. You may either tie at the back of the waist or at the front of the waist. This is important when removing the personal protective equipment later. After you have donned your gown, you will proceed to put on your gloves. This is important because you may be exposed to potentially infectious secretions or materials, such as blood, body fluids, non-intact skin, mucous membranes, and multi-drug resistant organisms. Removing personal protective equipment. Prior to removing personal protective equipment, take into account the type of gown you are wearing. Also, if the gown was fastened in the front of the waist or behind the waist. If wearing a gown that is tied in the front, untie waist ties. Then proceed to remove the gown by pulling gently from the shoulders, allowing the gown to fall forward. And peel down in a slow rolling motion off the arms, so that the inside of the gown faces outward. This will also peel off the contaminated gloves. Hold the gown away from the body and make sure it is inside out, so that you are not holding contaminated materials with your bare hands. Donning personal protective equipment for patients in droplet isolation. Proceed to aseptic technique. Then you will don a face mask. Place the metal strip over the bridge of the nose and tie up your ties or slip loops around the ears. Place the lower edge of the mask below the chin and tie the lower ties. Press the metal strip so it conforms to the bridge of the nose. Then you will don face shield or eye goggles. When splashing may occur, it could potentially contaminate your eyes. Then you will proceed to don the gown. This is important because your uniform may become exposed to potentially infectious secretions. Pick up the gown by the shoulders and allow the gown to fall open without touching any contaminated surfaces. Slip arms into the sleeves and fasten ties at the neck. Then fasten ties at the waist, either in front of the waist or behind the waist. And most importantly, don gloves. When you will come into contact into potentially infectious secretions or materials. In droplet isolation, we could have influenza, mumps, rubella, and meningococcal infections. Removing personal protective equipment after treating patients in droplet isolation. If wearing a gown that is tight in the front, untie the waist ties. Remove the gown by pulling gently from the shoulders, allowing the gown to fall forward, and peel down in a slow rolling motion off the arms so that the inside of the gown faces outward. This will also peel off the contaminated gloves. Hold the gown away from the body and make sure it is inside out. This will avoid you holding contaminated materials with your bare hands. Then discard in a proper waste receptacle. You will proceed to remove goggles before the mask by grasping by the earpieces. Then, remove the mask or face shield by untying the lower ties first, then untying the upper ties next, and disposing in a designated waste receptacle. Donning personal protective equipment. Proceed to do aseptic technique. Assess the need for personal protective equipment. Don gown, especially when the nurse's uniform may become exposed to potentially infectious secretions. For airborne precautions, you will follow the N95 respirator mask according to fitting and institution protocol. After N95 mask has been placed, you will follow with gloves when the nurse may be exposed to potentially infectious secretions or materials. You must ensure a tight fit around the N95 respirator mask, especially in airborne precautions, such as with tuberculosis. Removing personal protective equipment for an enteric isolation. Proceed to remove the gown, untying the front in a rolling fashion. Discard of gown and gloves in proper receptacle. Because of the microorganism, you will need to vigorously rub your hands and hand washing. Use proper aseptic technique